The views expressed in this video are those of the individual articulating them and not necessarily those of ICIC. We merely provide a platform for free expression and encourage diversity and freedom of speech. Our guests are responsible for their own opinions, and we encourage our listeners to critically consider different points of view. Dear friends, today we will talk to Jackie and Joyce, who are the mother and aunt of a very good friend of mine, Cindy, and they will talk to us about how they were made to take the so-called vaccines and what happened. Cindy and I have been friends for, I don't know, a year and a half or so. We met during our Crimes Against Humanity tour, and we've stayed in touch ever since. And Cindy then told me that both her mother and her aunt were made to get the shots, and I couldn't really understand what that means, but we'll find out now. So Joyce and Jackie, when did this happen? When did they tell you to get the shots, or did they give you a choice? Did they say you can say either yes or no? When did this happen, and how did they argue you should do it?
This took place in January.
But that was the booster. You had 2 Pfizer shots prior to that.
Right, in 2019, right?
No, in 21. In 2021, and they had no appreciable side effects from that.
Okay.
Nothing. So that's certainly kind of guided us on the booster shot. Well, so we got jabbed and no side effects or anything. But so there was definite pushing to us to get the booster. Absolutely. Like
why did they say you needed to get, first of all, why did they say you needed to get the shots in the first place in 2021?
They did not give any information like that. Just that we had to get it.
Reiner, this is a facility, senior facility with 550 round numbers of residents here. And when it's no secret that I urged Mom and Jackie not to get any of the shots for the reasons we know to be true. Mm-hmm. They kept saying the senior facility, and we don't need to name it, was following all the guidelines of the CDC. And for 290, then 93, almost 93-year-olds, that meant a lot to them, that their management was following the CDC. You kept saying that. Mm-hmm. They're doing the right thing until they both got jabbed and had this horrible consequence.
So when you got the first 2 shots, which was probably in early 2021, is that correct?
Yes.
Okay. You were not told anything. You were simply told this is because we're following the guidelines of the CDC. They never told you about any possible side effects or any pros and cons.
No, never. They just get it. They just told us what time, what room to go to, on what day.
And Reiner, I think it's of note that this is a pretty classy senior living place with lots of VIP retirees who've lived all over the world, have held very high positions in all manner of businesses. They have a wellness center here with nursing staff, and it's very accommodating. I think after you'd been living here basically 5 years, I think they had no reason to doubt the management.
Oh, no, not at all.
And don't forget, it was during the lockdowns. And they were blessed, right? People called you and said, oh, you're so lucky, you're twins, and at least you have each other. We're by ourselves. And they were even more frightened, those people. But Mom and Jackie were comforted that they could talk to each other about this openly and agree together to get it done for the good of the community here.
Oh, yes.
Right?
But you were never told about the fact that these so-called vaccines had never been tested, or were you?
No, nothing. All, as I said, the only thing that we were told was where to be on what day and our allotted time, and nothing about consequences of maybe, this might happen or that might happen.
Did they, when they told you to go to that particular place at that particular time, did they then ask you to sign anything? Did they ask you if you consented? Because this is medical treatment. Did they ask you if you consented to the treatment?
Yes,
yes,
and we were given a COVID card, like a credit card, a little one to keep, and the date that we got the shot, and which I still have. I don't know if you.
Yes, I have mine.
But,
Yes.
but that card was given to you after you got the shots. You were not given
right.
any information before you got the shots.
That's right.
We had zero information on what might happen. Nothing.
No
Okay,
warnings.
and then for some strange reason that I, by the way, never understood, because everybody kept saying, oh, this is safe and effective and this protects you from getting the infection or from being infectious for other people. For some strange reason, then out of the blue, as far as I'm concerned, all of a sudden they were asking everyone to get booster shots. Is this what happened to you as well?
Exactly.
Yes, absolutely.
It's exactly what happened to us.
Did they
So there were
explain why they, I'm sorry, did they explain why they wanted you to take booster shots?
No, just do it.
Just do it. And
when was that?
January
14th,
14th.
2022.
Yes.
January 14th, 2022, and that
Friday,
is
11 o'clock in the morning. Same time for both of them.
okay. And that was up until then, everything, you didn't have any side effects, any adverse reactions.
No.
But that's when it started, right?
Oh, yes, right.
Well-
72 hours later, I was in emergency surgery with a huge occlusion in my arm, big blood clot. My hand had already started to turn blue. And the doctor before I was released, said, you're very lucky you still have your arm. And I didn't even realize that it might have been amputated. I almost fell down when he said that. It was so frightening. And then the symptoms started showing up, one after another, splitting, horrible headaches, swollen feet, legs.
I didn't have
Tinnitus.
I didn't have a blood clot, but I had the swollen feet and ankles and legs.
You never had it before.
Never.
Off
never.
the charts blood pressure,
Yes.
like stroke type blood pressure. And I would just like to add this. I know it's their story, but Mom and Jackie got the shot in their right arm on that Friday. Mom was sick all weekend, such that she didn't even go out to lunch with some dear friends of theirs visiting. She had a malaise and just sore arm, you said, and just feeling funky. But she woke up the next morning, Monday morning, the 17th, and shrieked out. She had level 12 pain out of 10, thought she was going to faint. And her arm was numb, excruciating pain. And as she said, her hand had started to turn blue. Of note is that she was taken immediately to the emergency room at Scripps La Jolla here, good facility. And I happened to show up when the ultrasound tech was wrapping up the testing, and I heard her say she has a complete arterial occlusion of her ulnar, radial, and distal brachial arteries. And she was, boom, in surgery after the case the vascular surgeon was working on at that time. So it wasn't like she didn't feel anything over the weekend. She was sick over the weekend, but then the story continues after that hospitalization to all the other symptoms. Really countless trips to the emergency room, right?
In
ladies?
ambulances,
So many times.
so many times. Oh, with one thing or another.
And I think it's also interesting, would you please tell him when you started to share that you had had this most unfortunate consequence, and you put 2 and 2 together, they got the shot here and the occlusion was in that same arm. You would mention it to friends or neighbors here at the high rise, 2 high rises, and what did they say to you?
Oh, not much. They would just give us this look of
Roll their eyes.
disbelief, like, oh, you're making this up.
Oh my God.
Especially from the medical people.
Yes, anyone of the residents that we ever mentioned it to, just,
I mean, they looked at us as though, wow.
you know, they've really slipped. They didn't believe us that it was from the COVID booster.
But there's no other explanation, because as far as I understand you, you had been absolutely fine until then, both physically and
we
mentally,
were-
of course.
Yes, we were climbing up 8 flights of stairs every day and
walking a mile.
yes. And I mean, we couldn't lift one leg now, take it one step. Well, and this would have been the case afterwards too. We could not climb stairs anymore. We couldn't exercise. We couldn't do anything. And if we didn't have walkers, we would not be able to walk right now.
Right.
And
And before that, you didn't need any walkers.
Right.
I had a walker before, but that I don't know why. I mean, I didn't have a big problem, but
It was for balance.
Yeah, you'd had a knee replacement too, a number of years.
I had a knee replacement and a hip replacement on the same side. And after those 2 procedures, it was just more comfortable to use a walker.
Yeah. But you would still walk up 8 flights of stairs without any real problem.
Yes. And even our primary care doctor kept saying, I really don't think you should do that, you know, because of our age. And we said, why? We feel very comfortable doing it. And we did it. And we were fine with it until the COVID booster. And that just knocked us flat.
So that was within what, 72 hours of getting the booster shots?
Right, that I was in surgery, major surgery.
Well, how would anybody not believe you if you needed to have surgery? I mean, it can't have been made up.
They just think it's a coincidence.
And Reiner too, I went to all of Mom's appointments with her.
Sure did.
To the vascular surgeon and his very capable physician assistant. Very good, had worked with him for 23 years, very bright people. Well, in her post-op visits, Mom would say, I still have cramping up here. I go to do my hair or brush my teeth, it's cramping. And as God is my witness, she said, but your pulses are good. We're really happy for you. They're all good, Joyce. And Mom's saying, but I've got cramping. They would do the Doppler and check it. And I think my sense was that Mom had the major occlusion taken care of, and the residual, whatever the cramping, microclots, other clots in her arm and other places were inconsequential to them. She also recommended that Mom go on a medication. Imagine that they were encouraging more medication. This was a medication she said to Mom will change the shape of your red blood cells. And I thought, what are you talking about? Why would anybody do that? Well, it'll just make the blood flow better. And we think that would be a good idea for you. I gave Mom what's called the evil eye sitting across. We'll talk about it later. But Mom never went on that. But you were put on Eliquis immediately post-op after the arm surgery, right?
Right.
But a big dose of Eliquis, because I had AFib and they put me on 2.5. They put Joyce on 5. And
Twice a day, 5 milligrams.
And, but they never cared to look into the possibility that maybe it had something to do with the shots, because this happened right after. Never. Is it as though they refused to even recognize the possibility?
It was not a possibility.
It was clear. It was a systematic response from any of the medical practitioners they saw. We would bring it up and say, this looks like she got vaccine injured. It was like we spoke another language, didn't get it, didn't understand, they weren't going there. It was really a case of gaslighting for them, I think, to have this reality and to try to explain the horrific outcomes. And Mom's not done yet, because she August 10th had another major incident. Yeah.
So this
and these,
yes, please.
These symptoms it's not a coincidence that it's from something else. It is absolutely COVID shot. Yeah.
Well, here's the thing. The blood clotting is one of the major adverse effects of the so-called vaccines. We know, of course, in the meantime, these are not vaccines. These shots have never been tested properly. And it looks and sounds, from what you're telling me, as though they were really trying to not even acknowledge the possibility that this may have had something to do with the shots, which means they refused appropriate treatment for you. This is, in my view, and many years ago, I did a lot of medical malpractice law. In my view, this is a clear-cut case of medical malpractice. So the problems only arose after the booster shots. Before that, you were in good health. You were still walking up flights of stairs.
I never had a blood clot before. Never.
Going out to nice restaurants, coming to the house, being with grandchildren, children. There wasn't anything they shied away from doing.
Or that we couldn't do.
No. Just showed up.
It didn't even occur to them that two people complaining from the same adverse effects at the same time after having gotten the booster shots, that there may be a reason to look into this. It didn't occur to them. It's just incredible. It is just incredible. But I'm afraid this is not a one-off. This is what you have experienced. As far as I know from other people, my sister, for example, who's a nurse, telling me this is representative. This is, I would say, purposeful withholding of treatment. Because if they had looked into the possibility that it had something to do with the shots, they could have done something. I mean, the damage was done, but it sounds to me as though it could have been mitigated. So what has happened in the meantime? Where are you at? Are there any signs of things getting better for you?
Oh, no.
Oh, no.
Not for Joyce.
2 months ago today, August 10th, today's October 10th. The two of them were sitting here in their lovely apartment having dinner. Why don't you tell the story of what happened?
Well, Jackie came in and didn't see me and started to call for me.
I said, "Where are you?" And I walked on into the living room, and there she was on the floor with her head at an angle and just staring at the ceiling. And I do not know anything medical, but I knew she had had a stroke. And so I called downstairs to the wellness office, and they sent a nurse right up. He took one look at her and dialed 911. And
her whole left side was affected. She couldn't lift her arm, move her leg, and she couldn't speak.
Did they then finally take into consideration that it may have something to do with the shot, or still not?
Oh, no. The shot never came up. The shot was, just pushed aside. I mean, the shot wasn't even an issue. No.
And Reiner, I was out of town, and Jackie called me. I was in Texas for 48 hours, and she called and she said, she was sort of holding back, crying, and she said, your mother's not going to want to be someone who's drooling and dragging around her left side. I think we have to say goodbye. We can't let her carry on like this. So she was letting me know that we had to say goodbye to Mom. Mm-hmm. Unbeknownst to both of us at the time, my brother showed up at the emergency room, and Mom, in a muffled sort of way, had been offered the possibility of having a thrombectomy, a catheter up through the groin, up into her brain to pull out the clot. And in her muffled, sort of subdued voice said, let's give it a shot. And she agreed to do it, to everyone's surprise. Mm-hmm. And she underwent a thrombectomy.
At about midnight that night.
Had the clot pulled out of her brain. Great allopathic emergency room medicine, I must say. Mm-hmm. And she sailed through the ICU, the PCU, the progressive unit, through the hospital bed, and then to skilled nursing. But then she was put on a psychiatric med at the skilled nursing unit here in this facility to help her with sleep. She said she wasn't sleeping well.
I told the doctor I need something for sleep, and that's what he prescribed. Mm-hmm. And boy, another big hit to me.
Because we did not know until she was discharged. Nobody asked us, is it okay if we prescribe this or that? She had the discharge papers, and it said one of the discharge medications was Remeron, mirtazapine, for mood disorders. And I said, Mom, what kind of mood disorder do you have? And there was no mood disorder, nothing.
She needed something for sleep.
And it's also for major depression. And what we will tell you right now is that changed everything, because she didn't want to be on it. She said, I don't have a mood disorder or major depression. She'd been on it 9 days, 9 nights. The pharmacist said, sure, you can go off it. And what has transpired in the last 8 weeks has been nothing short of
a nightmare.
Horrible for her. She's turned into somebody with a mood disorder. So she never had depression,
never
anxiety. And this has been generated, we believe, from our observations from the medication she was put on. It's been tragic.
Did they give you a reason for this medication? Did they explain what the diagnosis for this was? Because the only thing that you wanted is something to help you go to sleep, right?
Right.
So you remember what it was for? It has a side effect of drowsiness, and they put it on a lot of their senior citizens. Put them on this medication.
And the dosage wasn't the
15
dosage?
15 milligrams.
Yes, mm-hmm. And somebody else, a doctor, I don't know, said that it was double the dose that she should have gotten.
For someone my age.
Yes.
Too many coincidences as far as I'm concerned.
Oh, absolutely.
These are not coincidences, I would say.
They are facts.
Yes.
She didn't speak this way after being discharged to skilled nursing. She did not speak. You can tell she has a bit of a speech
Mhm.
not slurring, but it's been affected. She wasn't that way before at all.
No,
I
It
thought
was
that
up-
was, I thought that was maybe caused by the stroke.
No, her
No,
speech was
no.
fine. She was walking quickly with the walker. She went from not being able, they would ask her, can you lift your hand up post-op? As she could go like that, her left hand.
Mhm.
And 4 days later, Mom, your arm was where you could move your left arm all the way up over
Right.
your head.
right.
I'm not,
Mhm.
and she could walk. This medication was also done to her. It's been tragic because she's been, as you said, it's been a nightmare. You've been locked inside this anxiety in your head.
Oh, that has been the worst experience of my whole life. I can't get away from it. When you
Mhm.
have anxiety, it's there. Oh,
And it's all started back with the COVID booster.
The
Just-
series of events. They've been fantastic residents here. And the
Mhm.
good news, Reiner, is that they've enjoyed all of the years they've been here, except for the recent hardships. But they'll walk down the hallway and people will say, okay, I know who you are. You're Joyce. No, I'm Jackie. And they've done this their whole lives and they've enjoyed it. It's been wonderful, hasn't it, girls?
oh
Oh,
yes.
yes.
Yeah. And people really, really appreciate who they are and their upbeat personalities. Well, that's gone now.
It's all gone.
I find it difficult to smile.
Wow. I find this, as a lawyer, I get angry, angry, angry. And as a lawyer, I'm telling you, this is why we need justice. No one will get away from this. You're not the only ones, but I'm very, very glad that you have the courage to speak out about it.
Oh,
That's why we are
absolutely.
lawyers. That's the
Oh,
only
you know-
reason why we're lawyers.
Well,
Right.
you know, this is the old adage, get up on the rooftops and scream and yell about a particular issue. And this is one of those where
It needs to be heard.
we were
Yes.
so innocent.
Oh, well, I told Cindy, I feel betrayed. You know, they were touting the COVID injections and the boosters like it was the magic bullet. And boy, it just turned around and smacked me big time.
Well, what they're also able to say now, ladies, is tell Reiner your new worldview on injections of any kind.
Mhm.
Oh,
We will
no.
never, ever have another injection of
Yeah.
any kind.
Not pneumonia, not shingles,
Not
not
anything.
flu, not anything unless it's for pain, right? Extreme pain.
Right.
They
Well,
learned the hard way, though.
this is my conclusion also, after having spoken to so many experts, doctors, biologists, scientists from all walks of life, real scientists, that is. Now I am absolutely convinced. I didn't used to be an anti-vaxxer, but I'm absolutely convinced now that never ever has there been any necessity for any vaccines, and that none of the vaccines, the so-called vaccines that they've used in the past, has ever been effective or safe. This one, least of all. This one, least of all. So this is not a mistake. This is not negligence. This is intent, but we will get them for that. So you are now in a position at which you've decided, I'm not going to take any further shots. You are, however, a little bit better, or how do you feel about your life after getting your status quo, so to speak, after having gone through the side effects, the adverse events that were obviously caused by the booster shots?
Well, our lives have been turned upside down.
Mhm.
Joyce is the most
Mhm.
between the two of us, but we're just old, beat up
crippled ladies now.
individuals that we can't do anything that we want to do as far as entertainment or exercise.
I mean, it's so bad that when I walk now, I deliberately choose where I step because I'm so fearful of falling. And I'm fearful of having another blood clot, God knows where, the brain and arm. It's very, very scary. Very.
Well, is it fair to say that's part of what this anxiety is about? You said you felt consumed by these scary, scary thoughts, having had the arm and the stroke, the clot in the arm. Now her primary at Scripps told her it could happen anytime again, that she needed to be aware of that, which I thought was cruel, actually.
Yes.
At this age. So mom had that thought planted in her head at the meeting, and I was with you, heard her say it, and you've been consumed with that
threat.
worrisome thinking ever since.
I mean, obviously, even if there were a really good lawyer who was at this moment ready to go to court for you, it wouldn't really make you whole again. Something will happen. This will be a part of the search for justice, because I mean it. You are the exact examples of why we lawyers are lawyers. This is what we have to make right as much as possible. I'm very sorry that I can't, as I'm just a lawyer. If I were a doctor, maybe things would be different, but I'm very sorry that there's nothing much else I can do, but I can't promise you justice. That much I can. Not just
That will
myself,
be-
but all the others will too.
Well, Reiner, at 94, thank you for saying that, of course. I offered them the Peter McCullough new recipe with the nattokinase, the bromelain, and the curcumin in the dosages. And I played some of that video for Mom and Jackie, and Mom's points that she's so consumed with worry and all now. She said, I don't have 3 months. I don't think I have 3 months to wait to see what might happen if I take those over-the-counter supplements. And that's a very real response from her. I can't talk her and Jackie in or out of anything. They've taken supplements galore these last months, a year and a half.
And we're done with them. We are
They're
done.
just worn out at this point.
I can understand that.
Yeah.
So what's next? What are you going to do?
We feel like it's just only going to get worse, because what's going to make it better? Nothing. Any of the supplements or medication that we both have taken have not helped. And Joyce just seems to be getting worse by the day. And I mean, it's tragic. And our lives,
Well, we were really smacked down when we weren't looking.
yes, we were not told. And, you know, all we were told was get the booster. You must get the booster. And so, backed by the CDC, we thought, okay, that's what we're supposed to do. And
Well, here's the thing. It's not only that, and this, what I'm saying is not, it's not based on my own knowledge, it's based on what experts told me. It's not only that the shots have never really been tested properly. The worst of the story is that there has never been a novel dangerous coronavirus that caused COVID. This, as far as I'm concerned, based on the evidence, based on the experts' testimony that I listened to, this was just a relabeled flu. This was designed to make people panic. That's why they said it's a dangerous novel coronavirus, when in reality it was just a relabeled flu. This is not based on my own thinking. I didn't wake up one morning and had these thoughts. This is based on Dr. Mike Yeadon, the former vice president of Pfizer, on his testimony. It's based on Dr. Jay Couey's testimony from Pittsburgh, based on Dr. Sonia Pekova's testimony and Professor Klaus Steger's testimony. They all say the same thing. This was engineered. This was engineered. These people who are behind this were out to take advantage of people like you who trusted the facilities, who trusted the agencies, who trusted their politicians and trusted the mainstream media, who were all lying. That's the worst of it. But that's also, at the very same time, this shows intent. This is not negligence. No mistakes were made. This is intent. This is intent. And you were absolutely right when you're feeling that you were taken advantage of, that you were taken down by these people, because you were. Because you were.
Well, of course, the bottom line was they were making so much money doing this.
Yeah, exactly.
They didn't care that Joyce Kreismer wound up having to have emergency surgery to remove a blood clot, and then the stroke and all of the other symptoms that we've had.
So at this point, is there did the doctors, the staff who are supposed to help you, were they able to show you light at the end of the tunnel? Are things going to get better provided that you take such and such treatment?
That was never addressed.
And we know that that will never come about. I mean, they totally ignore us.
And when they give us this look as though, what are you talking about?
You poor old thing. You know, that you're very old, and
You don't understand what's going on.
they don't recognize that COVID did this, and it's not a coincidence. I mean, 72 hours after Joyce's shot, the first blood clot comes up.
Yeah.
That's not a coincidence.
It wasn't COVID that did it, it's the shots that did it.
The shot did it, of course.
Yeah. Yeah. I would love to be able to do something to make you better. And I would love to hold these people responsible. I think we will be able to do that. It'll be a while though, but it'll happen. In the end, justice will be served. Each and every one of these people will be held accountable. It's coming out right now, and I'm especially grateful to you two that you are speaking out about it, because there's a lot of people out there who have experienced something similar to what you have experienced, and they too have been told, don't worry about it, it has nothing to do with the shots. They too were ignored when they said, hey, look, maybe it does have something to do with the shots. It is important for people to understand that they're not the only ones, that there are lots and lots and lots of these cases. And that's why it's so important. And that's why I'm so grateful for you to speak out about this.
Thank you.
Well, you're the only one that has listened to us. Nobody else, you know, they just roll their eyes and change the subject. They don't believe us.
Well, I'm sure glad that Cindy and I met, or else I wouldn't have met you. And I'm sure glad that you're still standing or sitting up and haven't given up. I do understand that you feel like they're taking away your lives, which they probably have to a certain degree. Mm. And that's why it's even more important and why it's even more courageous of you to stand up and speak out about it.
Oh,
So
that's
thank
the
you very
easy.
much.
That's
Well, I
the
mean, there are
easy.
little things that are so annoying, like my grandson's birthday coming up on the 12th.
Mm-hmm.
I can't get out to go somewhere to get a birthday card for him. I'm not able to do that. Well, that makes me very sad, that, I can't help celebrate his birthday. That's very minuscule
Mm-hmm.
to what Joyce has been through.
Mm-hmm.
But there's just a whole lot of things like that that have come up that have affected us.
Well, thank you for noting their courage, because they didn't have to do this, did they?
No,
No.
not at all. This is very unusual because most people, when you tell them to shut up, they shut up. You don't. That's the
No.
difference. It's as though, I can see how hard it is. I can't imagine what it feels like, but I can see how hard it is. And I really admire you for that, because it almost appears to me, Joyce, as though they have taken away your will to live, and still you're speaking out.
Oh, I've been.
Well, you nailed it.
Yes.
You absolutely nailed it. That is where she is now.
She's right
And-
there
And
at the finish line.
she is, because she wants to be finished with this. It is so discouraging. So thank you for honoring their courage. Thank you for seeing what you see here. And we're proud of them. And we would love to have a shift in any way to make them feel better.
But we know that's not going to happen.
We don't know, but
Mhm.
we can be believers in the anything is possible realm. And
I think the fact that you are speaking out is going to make a difference. Many, many, many people will see this. Many people will feel encouraged to not stop, to fight back, and to also speak out. And that's what we need. That's what we as lawyers need, because that's the kind of support we need in order to go and get justice. And justice must be done, because there cannot be peace without justice.
Right.
Right.
No,
We thank you for taking your time to do this.
thank you,
Well, that's
Reiner.
my job. That's my job. And also it's just, despite the fact that this is very troublesome, it's a pleasure to talk to you. It's a pleasure to talk to real people.
thank you.
Thank you.
Thank you. I think you've taken a big light and a big flashlight, and it's on both of them. I think after we hang up, we'll be able to talk about this. This was a lovely, lovely coming together.
Yes.
They
Definitely.
had a platform to speak their truth to
No one-
somebody who's listening and can make a difference.
And we're mad as hell that it even happened.
There you go, Mom.
It should not have happened.
That is great, because I am
Shame.
angry. I am angry. I'm mad as hell too. Well,
Shame on them.
There you go. Now we're getting to the good stuff.
yes, we'll get him. I promise we'll get him. I will turn off the recording button, and we can talk some more. Thank you so much for your courage. Thank you.
Our pleasure. We were happy to
Absolute.
do
was
it.
Easy.
Yes, it was easy.
Thank you.
Thank you.
Please support our work. With your support, you help us cover the necessary expenses for our work.